Greetings. Today we will discuss whether inflammation can accelerate the aging process. Aging is usually described as a slow, inevitable fading of the lights, but biologically, that's a lazy fairy tale. Aging isn't just time passing, it's the accumulation of cellular errors. For years, the wellness world has pointed to chronic inflammation as the primary driver of this decline. They've coined the term inflammaging, and they've told you to nuke it with turmeric and ice baths. But there's a massive catch. Inflammation is not the root cause. It is a symptom of a deeper, more structural failure. Before we demonize it, let's get the nuance right. Inflammation is a survival mechanism. Without it, you'd be dead in a week. The positive, acute. You cut your finger. Inflammation rushes to the site, kills bacteria, and signals for repair. This is appropriate inflammation. It's targeted, fierce, and it ends. The negative, chronic. This is inappropriate inflammation. It's a low-grade systemic smoldering that never turns off. The mistake experts make is treating inflammation like a standalone disease. They want to lower your inflammation. That's like muting a smoke alarm while the kitchen is still on fire. If your inflammation is high, it's because your body is responding perfectly to a biological disaster it can't solve. I'm the digital avatar of Dr. Max MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now, let's get back to today's topic. But before that, I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Very few people acknowledge this, but chronic inflammation often starts with failed plumbing. Your microcirculation, the massive network of tiny capillaries that feeds every cell, is the front line of aging. When these tiny pipes become sludgy, narrowed, or brittle due to sugar, sedentary lifestyle, or environmental stress, two things happen. Hypoxia, oxygen can't get to the tissues. Stagnation, metabolic waste can't be hauled away. When a cell is suffocating in its own waste, it sends out a danger signal. The immune system hears that signal and responds with inflammation. You don't have an inflammation problem, you have a delivery and waste removal problem. If microcirculation is the plumbing, mitochondria are the power plants. Conventional medicine says inflammation damages mitochondria, which is true, but progressive medicine realizes that damaged mitochondria actually create the inflammation. When your mitochondria are dysfunctional, they start leaking. ROS, reactive oxygen species. These are like sparks flying out of a broken furnace, rusting your internal CD, your DNA, mtDNA. When mitochondria break down, they leak their own DNA into the cell. Your immune system sees this stray DNA, thinks it's a viral invader, and triggers a massive inflammatory response. The bottom line, your body is setting off the inflammatory smoke alarm because your cellular power plants are exploding. Taking an Advil or a turmeric pill to fix this is like putting a piece of tape over your car's check engine light. Once the arsonists, microcirculation, and mitochondria have started the fire, the damage compounds, oxidative stress, the internal rusting that corrupts your DNA, telomere erosion, the biological countdown. Inflammation forces cells to divide faster to replace damaged ones burning through your biological fuses. Hormonal chaos. High inflammation blocks insulin receptors, stubborn fat, and tanks testosterone, estrogen, zero drive. Immune confusion. Your immune system gets distracted by the internal smoldering and forgets how to fight actual viruses or clear out cancer cells. Conventional medicine looks at a 60-year-old with joint pain, brain fog, and high C-reactive protein, CRP, and says everything looks normal for your age. Normal for your age is a life sentence. It's a polite way of saying your microcirculation is failing and your mitochondria are dying, but since everyone else is failing at the same rate, they won't help you until you have a clinical disease. If you want to stop the fire, you have to stop the arsonists. Restore the pipes, microcirculation. Use things like EWAT, exercise with oxygen training, shockwave therapy, photobiomodulation, light therapy, and specific peptides like BPC-157 and Vesugen to repair the vascular endothelium. Several additional nutrients can help. Renovate the power plants, mitochondria. Support ATP production and mitochondrial health with EWAT, heat, high-intensity interval training, NAD+ precursors, urolithin A, and CoQ10. Stop overfeeding the engine with processed fuels, sugar that cause the mitochondria to backfire. Clear the debris, support the search and destroy mission of your immune system to remove senescent zombie cells that are keeping the inflammatory signal alive. The gut ground, zero, fix the barrier. If your gut is leaky, you're constantly pouring gasoline on the fire. Your body isn't aging just because the calendar says so. It's aging based on the environment you create internally. Chronic inflammation is the interest you pay on biological debt. You can't just anti-inflammatory your way out of debt. You have to fix the microvascular and mitochondrial economy of your body. Stop blaming the smoke. Fix the arsonists. Visit ARTC Health or call us at 941-806-5511 to schedule your BioAge assessment. Stop by 6968 Professional Parkway E in Lakewood Ranch.